Module Overview. This module focuses on the underlying philosophical and ethical foundations that drive and inform palliative and end-of-life care. While Module 1 introduced the what and why, this module explores the how and why it matters. At the heart of palliative care lies a values-driven and ethically responsible philosophy that prioritizes dignity, autonomy, compassion, and justice. This module guides you through the moral compass, guiding frameworks, and professional principles that ensure care is not just effective, but also respectful, humane, and culturally competent. You will critically engage with ethical dilemmas in end-of-life decisions, including do not resuscitate, DNR orders, withdrawal of life-sustaining treatment, euthanasia, advance directives, and religious objections to medical interventions. Practical tools for ethical reasoning and decision-making in multicultural contexts are introduced, alongside key professional codes such as the ICN Code of Ethics and the WHO framework for ethical end-of-life care. Learning objectives. By the end of this module, you will be able to define the core philosophical principles that guide palliative and end-of-life care. Apply the 4 pillars of medical ethics, autonomy, beneficence, non-maleficence, justice, to real-life care scenarios. Navigate complex ethical challenges surrounding terminal care, including DNR, euthanasia, and futile care. Understand the ethical relevance of cultural beliefs, religious values, and spiritual needs. Communicate and document advanced care planning and patient preferences in ethically sound ways. Promote informed consent, respect for patient dignity, confidentiality, and interprofessional integrity. Philosophical foundations of palliative care. Palliative care is based on a holistic humanist philosophy that asserts dying is a part of life and should be approached with compassion, not fear. Patients deserve to live well until they die, with minimal suffering, adequate support, and emotional peace. Human dignity must be preserved irrespective of disease status, age, or socioeconomic condition. Care is not just physical, but also social, emotional, psychological, cultural, and spiritual. These principles reflect the bio-psycho-social spiritual model of care and are rooted in the moral traditions of both Western bioethics and indigenous cultural wisdom. Ethical pillars in palliative care practice. Ethical principle definition application in palliative care autonomy, respecting a patient's right to make their own choices, supporting informed decisions, honoring advance directives. Beneficence, doing good for the patient. Relieving suffering, offering comfort measures. Non-maleficence, do no harm. Avoiding overtreatment, preventing pain, no unnecessary prolonging of suffering. Justice, fair distribution of resources, and respect. Equitable access to pain medications, non-discriminatory care. Common ethical issues and dilemmas. DNR, do not resuscitate. Orders, respecting the patient's wishes when they request not to be resuscitated in the event of cardiopulmonary failure. Importance of documentation, family involvement, and ethical review boards. Advance directives and living wills, ensuring patients' future wishes are recorded and respected when they lose decision-making capacity. Futile treatment, avoiding interventions that do not improve quality of life and may increase suffering. Example: using a ventilator for a patient in irreversible coma with advanced metastatic cancer. Euthanasia and physician-assisted death. Euthanasia is illegal in many countries, including Nigeria. This module equips you with the skills to support dying patients ethically without violating local laws. Instead of assisted death, the focus is on assisted living until natural death. Cultural and religious considerations. For example, some faiths may reject morphine, blood transfusions, or feeding tubes. Respecting such beliefs while educating and ethically guiding decision-making is essential. Professional codes and standards. International Council of Nurses, ICN, Code of Ethics, emphasizes respect for human rights, dignity, confidentiality, and professional conduct. WHO framework advocates access to essential medications, ethical decision-making, and family involvement. NHPCO guidelines encourage continuous ethical education, interprofessional transparency, and case-by-case ethics consultation. Cultural ethics in end-of-life care. Ethics is never one-size-fits-all. Cultural norms heavily influence concepts of death and dying, beliefs about medical intervention, role of family in decisions, acceptance or rejection of hospice care, use of traditional medicine. In palliative care, ethical practice must include cultural humility, an ongoing process of self-reflection, open dialogue, and partnership with patients' belief systems. Ethical documentation in practice. Ethical practice in palliative care is not complete without accurate, respectful, and timely documentation, including patient preferences, consent and refusal of treatment, cultural/religious considerations, family communications, DNR, or advanced directives, ethical dilemmas encountered. Self-ethics for care providers. Palliative care professionals must also engage in moral self-checks, including boundaries with patients and families, managing personal bias, recognizing moral distress, avoiding compassion fatigue, practicing reflective supervision and mentorship. Module 2. Summary. This module reinforces the idea that ethical caregiving is just as important as clinical caregiving. Professionals in palliative care must be legally informed, ethically aware, and compassionately responsive in their daily decision-making. Ethics is not simply about choosing between right and wrong, but about creating space for dignity, choice, peace, and justice at the end of life.